Okay, good afternoon and welcome everyone. My name is Fraser Keegan and I manage the innovation team here at the CIH, and I'll be hosting today's event. Before we start, I'd just like to acknowledge that the CIH is located on the traditional lands of the Kaurna people and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. Before we start, just a little bit of housekeeping. This session has been preset to keep your microphones on mute and your video feed turned off by default. However, this will be enabled during Q&A time after the presentation. Also letting you know that only the presentation will be recorded and published. The recording will be stopped for the question time. When we do go into the Q&A, please use your mics and enter your questions into the Q&A. And please, by all means, turn your cameras on so that we can see your smiling faces. So for those of you who are unfamiliar with the Commission on Excellence and Innovation in Health, or the CIH for short, we're the lead agency for innovation in healthcare in South Australia. And we love to bring together clinicians, consumers and other collaborators together to turn ideas into better healthcare. So our vision is together creating health and prosperity for all. So to do this, we support the sector to come together and imagine new ideas for better healthcare. We also acknowledge that better isn't always excellent, but we're committed to measuring what we're doing so that we can make a meaningful impact. So sometimes it's not the big ideas, it's the combination of the smaller ideas. And this is the essence of why we host the Improvement and Innovation Showcase. We're trying to help people to connect across the state and across the sector, and it's all about sharing ideas and improvements and innovations. So during the series, the sessions are approximately 40 minutes and they are recorded and available online at any time. And what we're trying to do is to provide a space to explore what others have learned. And we aim to keep it simple and share work that's happening across the state. We don't just wait for work that's already been completed or published. We're happy to interject in the interim. Mostly we focus on South Australia, but every now and again we might share a showcase from outside our state just to ignite some ideas. And a quick shout out that if you have a problem, or if you've had some success addressing a problem, or you've learned things along the way, or if there are themes that you'd like the Commission to explore, please get in touch with us via the email on the screen and we'd be happy to have a chat. So just to remind you that the theme of our 15th series is digital and data-based innovations. We know that innovation and data are interdependent, and so the landscape is changing rapidly, and each of our speakers has been asked to describe the work that they do in this space and to demonstrate how this interdependency exists throughout the innovation journey. And in terms of the context for the innovation journey, some of you may already be aware of the innovation model we released last year that provides an overarching guide to nurturing and maturing a great idea into something that can be deployed at scale. It was being constructed from a combination of literature reviews, industry consultation, and we've also referenced it against the ISO standards for innovation. So if you check out our website, you'll see that the model is there. We've also got links to useful references and guides. And so through the series, we do have a range of speakers who are sharing insight on the work that's happening in their world. And if you haven't registered for the other sessions in the series, we invite you to do so now using the QR code in the corner of the page. We'll also post a link into the chat after the Q&A for those who want to register. Please feel free to forward that to others. So I'd like to now introduce our speaker, Dr. Marc. Marc is a digital health leader with a passion for building fast, effective and user-friendly solutions that genuinely improve healthcare for clinicians, patients and systems. Marc strives to bring clinical, technical and administrative teams together to deliver real-world impact. He's a graduate of the Australian Institute of Company Directors and a certified FIRE developer, and is currently driving an interoperability program at Digital Health SA. So welcome, Marc. Thank you for your time, and I'll now hand over to you.
Thanks very much, Fraser. Lovely to be here. It's a wonderful opportunity to talk to you about one of my personal passions, which is interoperability. Now, I don't need to tell you all that scaling innovation is very hard, lots of things working against us for so many reasons. And my aim here today is to persuade you that embracing data interoperability standards is a key enabler that will help your innovations to succeed. And so to help you make up your mind as to whether this proposition has any merit, I'll first share a little bit about my innovation story, and that's what's led me to believe that interoperability is one of the most important factors in successfully innovating and scaling in healthcare. So at the start of my career in 2000, I was just commencing as a young doctor after having come from a rural farming upbringing. And during my residency, I found myself with a decision to make. I wasn't quite ready to go into my specialist training, and the opportunity presented itself to co-found a startup in digital healthcare, and I chose to jump into that. And so I spent the next 9 years or so covering emergency departments and intensive care units across Adelaide, mostly at night, whilst bootstrapping this startup that produced software for doctors to perform routine tasks like finding their patients on the ward, ordering tests, reviewing results, prescribing medications and writing notes, and all of those things that we expect from the class of solutions that we refer to as EMRs today. So that solution was ultimately rolled out to many hospitals across Australia and then also internationally. Now, one of the reasons that the solution had a lot of functionality was because we had to keep pivoting to find what would actually resonate with the market. It wasn't driven from a position of strength, it was driven by survival. And so we learned a lot of hard lessons about trying things and failing fast, about staying lean, applying the latest technology as quickly as possible, and keeping an incredibly close eye on the finances, which enabled us to keep going. And through that time, an enormous amount of effort was spent in connecting to patient administration systems and laboratories, dictation systems and pharmacies, and the list is endless. It goes on. Anytime you're trying to put in a software solution in healthcare, there's a lot of integration to do. So my medical work was paying the bills, and slowly over those years, the business and the product was expanding and ultimately became established in the Australian market. And then in about 2018, another pivot point in my career arrived, and the company was sold to a globally significant digital healthcare company called Allscripts, which many of us here in South Australia know well. And the next phase of my career started. So the priorities that were technology and finance and fast execution pivoted a little and became superseded by people management and motivating teams, and putting together sound strategy and organising effectively to deliver on those strategies. And so in leadership roles at Allscripts and then at Telstra Health, and then in some consulting roles since, I've still been endeavouring to achieve those initial aims of my first career pivot and get some excellent software into the hands of clinicians and patients so that we can improve how healthcare is practiced with technology. And what I've found over that 25-year journey is that pretty much every healthcare system and set of solutions across the world that I've come across, and they might be large, they might be small, they all struggle with getting access to data out of the ecosystem and in giving data back. It takes months and sometimes even years to negotiate and deliver data integrations. And that's where the new international interoperability standards come in, because in the new paradigm, you can have your data flowing in an afternoon. So back in the year 2000, this was the state of the art in terms of computing and what sat on the desks in the residence room. And if we fast forward to 2025, we can see that they now have wheels, and you can sit and you can stand. But the overall technology experience in hardware and software is pretty recognisable to the junior doctors and clinicians of 2025 as in the year 2000. And part of the reason that we haven't progressed over that time is because it takes so much time and energy to get data to flow across the system, and the opportunity cost of doing that robs us of producing better software. So to make the economic case for interoperability standards and implementing them, it's worth noting a white paper from the Australian Productivity Commission released last year that found that simply by using data better from EMR systems and reducing length of stay by a very modest amount can save up to $5.4 billion per year in the Australian healthcare system. Now, who doesn't want an extra $5 billion into the healthcare system that can be applied to greater effect? And there are also substantial savings available through really humble productivity improvements, fewer duplicated tests, more automation of routine tasks to save time, reducing travel. And everybody's talking about AI and wanting to leverage that for the next unlock on productivity. And to make high quality AI, you need high quality, precise data as inputs to train your models. And so again, the data and interoperability standards are key enablers of that. To overcome the barriers that have existed for several decades now, which are many different systems with many different interfaces that ultimately lead to information silos that lock our data up. There are many definitions of interoperability. I like the simplest one from Graham Grieve at the bottom left. It is simply the ability of two or more clinical teams to transfer patients and provide seamless care. There's no mention of technology or data in there. That's just a given, right? And so what kinds of transfer of patients and seamless care and the data behind it should occur? It's between those solutions at the point of care, whether in your clinic or on your ward. It's between the solutions internal to an organisation like SA Health or any healthcare provider. So our PATH systems, our EMR systems, our laboratory and radiology information systems. Within an organisation like SA Health, there are hundreds of solutions and thousands of points of interconnect between them. And if we then take it up a level to the healthcare ecosystem as a whole, and our partners in the private sector and community care and at the Commonwealth level, you can see that the points of interconnect start to take as much, if not more, of a priority than the solutions themselves. We talk a lot about patient care being the gold standard, or patient-centric care rather, being the gold standard in healthcare, and yet we don't often we don't walk the walk when it comes to the way we handle our data and integrations. We actually operate in a solution-centric and an organisation-centric model, and the patient has to bounce between them. In a very simple healthcare journey, they will connect with dozens of different services, and they'll have to repeat their story many, many times with all of the inefficiencies that involves, all of the loss of convenience and repetition, but also the mistakes that get made as data re-entry gets mucked up, that communication doesn't happen, and that the best care isn't given. So technology and interoperability standards are actually a bridge from our current practices of organisation-centric care to patient-centric care. So here's the fun bit, and the tagline of my presentation today. Do we want to be like Forrest Gump, or do we want to take our inspiration from Peter Parker? So the current state of interoperability and integrations is kind of like Forrest Gump and his famous line of, life's like a box of chocolates. You never know what you're going to get. And integrating systems is like that at the moment. The integrations or the connections are built one at a time, and a team of people spend weeks or months negotiating a single exchange of data between system A and system B. And then very little of that actually gets used again in future for the hundreds and thousands of connections that need to be made every year and every decade across our healthcare ecosystem. And the outcomes of that are the accumulation of a backlog of too many integrations to be done by too few. It can take literally years for your integration request to get to the front of the queue and be implemented. And it blows out development timelines, makes things difficult to support and scale, and ultimately causes failed innovations. So the great tagline from Spider-Man and Peter Parker is, with great power comes great responsibility. And I think with great interoperability actually comes great data, great innovation, and great technology. And so by baking in interoperability standards into our design and into our solutions, our development is rapidly accelerated. The trust and reliability in our data and the timeliness of its flow is dramatically improved. And it actually means that your innovations can, out of the box, potentially be scaled to national and international levels and listed in app stores. And that ultimately leads to successful innovation and realised healthcare benefits. A little flashback to my rural and regional upbringing. When I was a boy, salinity was a big ticket issue as it slowly kind of damaged pastoral land and left it unusable. And it was a man-made problem, many decades in its creation due to the clearing of trees that led to the groundwater tables rising and washing the salt further downstream into the soil. Now, it seemed like an impossible problem and an intractable problem because it required goodwill and cooperation and long-term planning from a plethora of people who will probably need to act against their self-interest in the short term. And if we fast forward to 2025, that intractable solution has actually substantially improved in the Murray-Darling Basin. Now, salinity is not a solved problem globally. It's still a massive problem, but the situation in the Murray-Darling Basin is far better than it used to be. And that's because Farmers were incentivized to plant trees. New technologies were embraced and adopted to reclaim salt-damaged land and to reinvigorate it. So we have the ability to solve these problems if we come together as communities, recognise where our different interests are coming from, and finding a way forward together. At SA Health, we have developed a kind of 6-phase interoperability roadmap and journey, divided into the vision, the resourcing, the factory, the engine, the wheels, and the benefits. And it's important to segment it into that many gaps, because we all want to get to the ultimate benefits in healthcare in the form of the quintuple aim. But getting there is a multi-step process where there's not necessarily a payoff until the end. So we've established the vision of where we want to get to, and we've sought the resourcing in terms of funding and personnel to put it together. And those people and that money will be applied to producing the factory. And those are our people, our processes, and our technologies and our ways of working to build the engine. Now, the engine takes the form of core technology services that use an interoperability standard called FHIR, that use clinical terminology services and dictionaries like SNOMED CT and LOINC and Australian Medicines terminologies, that use national identifiers for identifying our clinicians and our patients and our organisations, such that they can be recognised by every organisation and every system across the country, and wrapping that up in a secure, trusted and auditable platform. Now, by itself, that doesn't help healthcare at all. That just gives a capability and a maturity. And it's actually what we call the wheels. It's the systems that we use at the clinical coalface every day with our physiotherapists and our nurses and our pharmacists and our doctors, utilising the systems of record and new systems of engagement to perform their daily tasks. And if they're able to do that in an interoperable way, that enables virtual care, that enables electronic prescribing and electronic requesting of tests, and to apply automation and AI agents, then that's how we start to see the healthcare benefits from leveraging our data in a far more efficient and productive fashion. So the community in Australia is established by a consortium called SPARKed. Our SPARKed is comprised of the 4 initial partners, being the CSIRO, the Australian Digital Health Agency, the Commonwealth Department of Health and Aged Care, and HL7 Australia. And around those 4 initial partners, literally hundreds of healthcare organisations and technology vendors have gathered around to drive this consortium, this interoperability community further, and to establish and embed those standards that will enable our data to flow. Now, SPARKed has been so successful in Australia that it is actually becoming a model that is being sought to be adopted by other geographies around the world. And so we're actually getting quite a lot of international participation in SPARKed events now, so that they can take those kind of events and ceremonies and ways of working back home to establish their own national data and interoperability standards. And so I've thrown this slide in just to have it on record, because my major call to action for this whole group and for the healthcare community as a whole is to actually register for SPARKed, to just join it on LinkedIn, and you'll gradually absorb quite a lot of information over a period of time, which you will be able to apply to your innovations and help you run them more efficiently in a data sense, and scale your innovations across South Australia, across Australia, and ultimately internationally. And there's absolutely no reason that we can't make globally changing innovations from right here. So in terms of calls to action, now what should this group really look to do if I've convinced you that interoperability standards are an enabler for your innovation? Please do become aware of and use the new Australian FHIR standards, the national identifiers for our patients and our clinicians and our organisations, and clinical terminologies like SNOMED CT and LOINC and others in your healthcare solution. And it will actually make your solution move much faster in its design and development, and move much faster in its implementation and distribution and scaling. Now, one caveat to that is that FHIR isn't necessarily a great standard for analytics, and analytics is a huge part of creating a learning healthcare system. But there are other standards that are well suited for that, and a standard called OMOP is one of them. So I want you all to be aware of that OMOP exists and is a real enabler for clinical research and operational insights from big data. And there are standard pathways to convert from FHIR to OMOP. So you don't need to invent these for yourselves, that's already been solved for, and you can benefit from the work that others have already done. My big call to action is to join Spark, and if you can, actively participate in the clinical design groups and the technical design groups that are driving the Australian standards forward. Now, the FHIR Australian Standard version 1 of that was released last year, so we're going to start to see that progressively filter through into the big ticket solutions from major vendors from here on in, and we can look forward to version 2 being released at some point in the next 12 months. And what we'll find is that there'll be 12 to 18 month releases, probably, ongoing forever, as this richness of the data model and the ways of exchanging data continue to evolve and improve. I encourage you to join HL7 Australia if you're a creator of software. And what that'll enable you to do is actually test your software at connectathons that happen 3 times a year. And by doing that, what happens when you front up to implement your software in a new environment is it's already been tested against all of the major solutions in the marketplace ahead of time at these connectathons. And that's what literally enables you to plug and play your solution in an afternoon. It may not even require human intervention. It can be downloaded off an app store and stood up by someone who you've never spoken to. And the last do that I want to leave you with is to think global. If you're solving a healthcare problem with technology here in Adelaide, there is absolutely no reason that it can't be applied anywhere in the world, particularly if you're using Australian interoperability standards, which have been inspired with and are compliant with international standards for data exchange. Please don't create your own data models. If you're creating your own database, which will hold the demographics of your patients and their diagnoses and their medications and their allergies, you don't have to invest all of that effort. You can join Spark and you can learn about how that's already been done by clinical informaticians, and you can take that off the shelf. And you can also take the technology, the database technology and the web APIs in multiple forms, whether open source or commercial and enterprise. You can take that off the shelf. Don't roll your own identifiers and codes for your medications and your blood tests. Use the standard ones that are available in dictionaries like SNOMED CT. And please don't create bespoke integrations to connect System A and System B that will only ever connect System A and System B. Use reusable data exchange standards that you can repeat with minimal effort thousands of times over. So thanks for listening. I think that, absorbing these do's and don'ts will give your innovation one extra shot to succeed. There's a whole long recipe list of things that are needed to make innovations ultimately successful, but this is just one more that will be a significant accelerator for what you're seeking to achieve.